All right, so we've entered the hospital. Whenever we enter the hospital, we perform full hand washing. So I've done that. I've checked my orders, and I have a order for a patient to get a Foley catheter. So I'm going to go ahead and gather the supplies to do that. I'm going to get a couple of washcloths for pericare, the actual catheter kit, a blue chuck pad, and a bath blanket. Got all my supplies, so I'm going to go ahead and enter the patient's room. Hi, my name's Jay. I'm a nursing student at Mount St. Joseph University. Can you give me your first and last name, please? And can you tell me your date of birth? Good deal. Checking the wristband against the MAR. And do you have any drug allergies? No? All right, well, the reason I'm here is I'm going to place a Foley urinary catheter for you for your surgery this afternoon, so we're going to go ahead and get that done. Is that all right? Okay? All right, so now I performed hand hygiene. I'm going to go ahead and assess the patient for the catheter, so I'm going to just pull up your gown here.
Okay, so I arrive at the hospital.
Have a look at the abdomen.
I verify the doctor's orders.
Checking for bladder distension, anything like that. I'm going to raise the bed to a safe working height.
So I enter my patient's room and begin the whole process. So I knock on the door. Hi, I'm Rachel. I'm a student nurse with Mount St. Joseph
Bring the
University.
patient down a little bit so the catheter procedure goes easier for him.
Can you confirm your name?
All right, so I've assessed the abdomen. It all looks good. We've assessed the need for the procedure, the surgery this afternoon, so we're going to help go ahead and
So the orders we have today are
begin preparing to perform the procedure.
which is going to
So I'm going to go ahead and get just some clean gloves on, hand
Are you having
hygiene.
difficulty breathing? Yeah, okay, well this should hopefully help, okay? So before I get started, I'm gonna just give you a quick assessment. I'm gonna raise the bed here. Alright, assess your nares here, your nostrils for irritation and redness.
I'm going to go ahead and get this blue pad onto the patient. So I'm going to do that is
your lungs.
just going to have them put their knees up.
And then the pulse ox, I believe
Here.
you're not where we want you to be, so this should hopefully help you start breathing better, okay? I'm gonna go ahead and get started. And I've
Suck it
gathered
up.
all of my supplies.
Alrighty.
Turn on.
Now I'm going to go ahead and at this point I would perform perineal care if the patient needed any. Got a washcloths for that. In this case they don't. So we're just going to proceed. So I'm going to go ahead and
Raise the head of the bed a little
get
bit.
my gloves off,
And I might have to get this
perform hand hygiene again.
in arm's reach. Before I'm sterile. Otherwise I'm gonna be in big trouble.
Now I'm going to get the patient situated with a bath blanket for privacy.
Alright. Are you
So,
comfortable?
I'm going to go ahead and drape it over their abdomen. And then just kind of wrap it and secure it around the legs,
This is just in case
like so.
you have any messes. And I can ensure that my space is clear, is wiped off. I give it 30 seconds to dry. And to apply my sterile supplies.
Alrighty, that's all good. So now I'm going to go ahead and begin establishing my sterile field for my catheter kit. I'm going to grab an alcohol swab, wiping down the surface of the table. I'm then going to perform hand hygiene again. Take the kit out of its bag. Pull the bag down. I'm going to be using this as a garbage bag during the procedure, so I'll just kind of keep that at the patient's feet. I'm then going to begin unwrapping the catheter kit using sterile technique. So, not going over top of it, using the borders of the paper, unwrapping like so, sliding it up to the front of my table here. I'm now going to don my sterile gloves. I'm going to take those out using sterile technique, only touching the borders of the packaging. I'm going to grab it by the cuff.
So the lube was for
I am going to attach my catheter. I'm going to place my dominant hand.
the
I'm going
lube
to attach it
was when you
to the suction,
And then looping for the second glove.
keeping
Into
my
the cup.
dominant hand sterile. And I'm going to test the suction.
Okay, sterile now.
It seems to be functioning.
I'm going to go
properly.
ahead
So
and
next
start
thing I'm
removing
gonna
the
do
pieces I need from the
is
catheter kit.
approximate
So I'm going to
the distance
take out
from
my pads. I'm going to apply the
mandible to the
bottom
ear.
pad first with the shiny side down.
Indicate how far I will insert the catheter, and I have that approximation. So the next thing I will do is
I'm going to
I will lubricate
tuck the pad
my suction.
underneath the patient, careful not to touch the patient themselves, just tucking the pad underneath.
The supplemental oxygen.
And then going to apply
I
the
will begin inserting
second pad.
in the air up to that spot that I measured out.
This is broken from our
And
previous
I
video,
also
but
feel
in real life this would be a whole piece of paper.
because these gloves don't fit me. So what I would do is I would then remove it and then get a new pair of gloves and redo the technique.
Taking care not to touch anything.
But for this purpose, we're gonna keep going.
So I'm going to go ahead
Try to be
and
mindful of that. So
take the
starting
top
over.
kit out of the catheter.
I will be inserting
Remove my sterile gloves
up to that point that I measured out.
and call someone for new
Mindful
gloves
of my large glove. And I'm going to suction.
because I broke sterile
for more than
technique touching the
15
blanket.
seconds.
So new gloves.
And then as I remove, I'm gonna rotate.
So again, I've got a fresh packet of new gloves.
For me.
I'm
Awesome.
using sterile technique to don these properly,
This is my
as I
non-dominant
previously
hand to
demonstrated.
reapply the oxygen. And I'm going to clean
All right, so now
my suction.
We're taking
and then
the
I'm keeping my
cup out of the
eye
catheter
on
kit.
pulse ox, still not improved. So I am going to suction.
We're
again
getting
after
our
1 minute. So I wait a minute
little
and I
swabbies
suction.
ready.
We're all cleared. And then once again, non-dominant hand.
We are going
remove
to
the suction.
take the catheter out of its sheath
Insert the catheter
here.
to that point. Really watching those gloves. And then I'm going to suction again
We are going
for
to
no more than 15 seconds.
attach the sterile solution to the catheter so it's ready.
When you're
Taking
out,
care to keep this sterile.
I encourage the patient to cough. Great. We're going to put oxygen back on.
We're then going to
I'm
dip
washing
the end of the
pulse ox. It
catheter
looks really good.
into the packet of lubricant
So I'm going to disconnect my
so that
catheter.
it's sterile and ready to go. And then
I'm going
I'm going to take the entire box
to
kit over to the patient and place it on the sterile pad fully.
hand hygiene.
We're then going to put the lubricated end of the catheter.
On
Before we do that, we're going to cleanse the ears from meatus. So I'm going to take my non-dominant hand, push down. I'm going to use all 3 swabs down the side, down the other side,
That's great. Sound
and
much
down
better.
the middle.
So then
That's now cleansed and sterile.
I will perform here.
Got my lubricated tip on the catheter.
Gloves.
I'm going to ask the patient to bear down while I insert it.
I'm sorry. Oral hygiene.
Insert it
Clean their teeth. And then
until I see urine start to flow, and then I'm going to insert it for approximately another 2 inches.
I would clear up
Then I'm going to
this mess.
release the meatus, grab the tip of the catheter with my non-dominant hand. I'm going to inject. I checked that the Catheter calls for 5 milliliters of solution for the balloon, so I'm going to inject 5 milliliters. Take that off, throw it away. Now I'm going to remove my gloves.
Slowly but surely. Appreciate you.
Perform hand hygiene.
Return the supplemental oxygen level to what it was prior to.
Don a new set of clean gloves.
You were lower, but that is locked. Here's your call light if you need anything. That's all I got for you. I'm glad you're feeling better. And then upon
Clean gloves
documentation,
on,
I would
hand
document
hygiene.
the amount, color, and consistency of the
Now I'm
solution
going
taken
to
out. I would document the catheter size that I
Move
utilized.
the box out of the way.
She was experiencing pain.
I'm going to
and all vital
affix
signs that happened.
The
During
catheter.
and
I tested tugging that it's all secure in there.
I think I got it. I think I covered everything that I.
I'm going to affix the catheter to the patient's leg. Securely. Run the bag down. Oh.
You want to try? You don't have to if you don't want to. Not probably give it one run through and then I'll work. If that's, yeah. And then
Take the bag. Now I'm going to start cleaning up. So get all the pads out of the way. This is all going in the garbage. I'm going to assist the patient to move to get the blue chalk out from under them. That's going away. Remove the bath blanket. Get the patient comfortable. I'm going to assess the abdomen again, just to make sure there's no distension. Going to check in with the patient, ask if they have any pain. I'm going to check in the bag for the color and quantity of urine. I'm going to raise the patient back up to a comfortable position. Check on the patient, see how they're doing. Raise the bed down. Do you need anything else while I'm here? This is your call light. Comfortable. Alright, the patient says they're comfortable, they don't need anything else, so I will be back to you. Check on them in about an hour. Remove my gloves. Perform hand hygiene. All this is going in the garbage. I leave the patient's room, and then I'm going to document the time at which a Foley catheter was inserted, how the procedure went, the patient tolerated it well, there was no pain, the color and quantity of the urine, and then how much sterile fluid we used to inflate the balloon in the catheter.
Right. I get to
I think
the
that's it.
hospital and I walk